Evangeline has asked which email address they can send their papers to for corrections. Maybe you can respond to that, Dr. Adam.
My email address will be available, and Denton's email address will also be available, so we can both share, and then we can be able to see follow up with the corrections that would be there. Denton, can I speak on your behalf?
Yes, of course. Yes, yeah.
Thank you.
Okay, can see someone has said we can share the notes.
The notes will be shared through the recordings that would be done, which will be available on our YouTube, and our coordination team will coordinate to see how it can be shared. I can see Denton has also shared his email, so I'll share mine as well, so that you can have both email addresses.
Okay, there's someone also has asked how many abstracts can primary author submit?
Is this for this particular conference?
Shadrach, kindly, is it for this particular conference?
Yes.
Yes.
Yes,
so
he's saying yes.
You can submit as many abstracts as you wish, but it will depend on the conference itself. As you are aware, the conference is three days, and we cannot be allowing one particular speaker to be speaking for more presentations. So the reviewers will look into that. They provide opportunity for everyone to be heard and everyone to be engaged. So you can submit as many as you can, but the strong abstracts that have been identified will be the ones that will be used for the poster presentations and for the oral presentations that will be there.
Thank you, Dr. Ari. Evans Nyayemi is saying if you can, in a nutshell, kindly explain to him about QI.
He wants to understand the QI. I would suggest he continues the quality improvement webinars that are ongoing in this particular series, because I cannot nutshell or give a snapshot or give an abstract of QI. Quality improvement is very huge. There's a lot that needs to be done, but as I said, a quality improvement is what we do. We look into what was not there, what did we do, and what was the outcome of what we actually implemented. And that would actually bring in the aspect of research in the quality improvement.
Thank you, Dr. Ari. Evelyn is asking if you can kindly elaborate if a best practice can be submitted for a scientific conference.
Yes, a best practice can be implemented, submitted for a scientific conference, but what was the research aspect that was actually brought in, that brought about the study that you actually implemented? What was the intervention that you did? So that would bring in the aspect of what was not there, what did you do, and what was the best practice that allowed you to make the change.
Okay, can see Roslyn Kenya has raised her hand. Roslyn, kindly unmute yourself.
Sorry, my issue was sorted. I lowered my hand. Thank you.
Okay, thank you. Godfrey Nato.
Thank you, Phyllis. I hope you can hear me.
Yes, I can.
Yeah, I was just following the presentation, and I think it is quite informative. But I just have probably two questions to Denton. One, in university setup, we always insist that when our students are preparing papers, the abstract is in one paragraph. I can see the examples you have given us has been sections into four: background, approach, lessons learned, and conclusion. What will you think is the best way out of this? I know when you section like that, it comes out so clearly, and you can follow the abstract probably better than when it is one paragraph, and you'll wonder where the background ends, where the approach comes in, and where the conclusions begin. That's number one. The number two, the latest trend has been that the abstract is accompanied with keywords. And I know that has always been a problem. So which words do you put in the keyword so that your abstract can be catchy and can be seen when someone's on the internet? Thank you.
Yeah, thank you. Interesting question. So to the first one, the structure of the abstract is almost always determined by the place you're submitting it. So if it's a conference, they'll have guidelines that you should follow. If it's a journal, they'll have guidelines. The first example that I used was from the Lancet. They have totally unique abstract guidelines of any other journal because, that's the way they want to do it. So whatever you're doing, make sure you read the guidelines, because if you do submit something and it's not following that, sometimes they'll just, reject it outright. But personally, I like the headlines. I think it makes it, as you say, easier to follow. But it is true that for many disciplines outside of medicine, it's most common for an abstract to just be a big block of text. Again, I don't, just do whatever the guidelines are, and don't be afraid to develop your own style as well. When it comes to keywords, this is a really good question, actually. Yes, you're right. Many submissions do also want keywords. And this is a thing I see people maybe confuse. Keywords should be words that don't otherwise appear in your abstract or in your title. The title words, the abstract body words, these are words that are already being indexed and included. So keywords are your chance to introduce other words that maybe are relevant, maybe another way to say something, but that you haven't had a chance to say. Yeah, if that makes sense. But that's a really tricky one, the keywords. Finding the right keywords, it's usually, in case anyone's curious, to help search engines index abstracts. That's the main reason for keywords.
Okay, thank you, Denton. Maybe I can say for those who are requesting for the notes, they will be shared to you through the emails you used to register for this webinar. Then Dr. Adam and Denton, there's a question. Someone is asking if you have a mechanism to curb plagiarism. And Dr. Adam, will you accept abstracts from other counties apart from Mombasa?
I think the poster that has been shared, it is very clear that last year we were only accepting the abstracts that were submitted from Mombasa County, but this year we've opened up to see what have been the good researches that have been conducted even out of Mombasa County. So yes, it's open, but we would keep at least a ratio that would be more presentations from Mombasa County. But yes, it's open to studies that have been conducted outside Mombasa County as well.
Thank you, Daktari, for that comment. Yeah, I can see Evans is saying he has learned something. Thank you, Evans.
Yes, and before I would forget, we go to the next thing, which Denton, if you would like to talk about it. Yes, there you go.
Yeah, thank you so much. So it's great to see so many people interested in research. And starting next month, my organization, MSF, in partnership with our friends at the Department of Health, are going to be launching a research training initiative that's specifically for employees of the Department of Health here in Mombasa. So it's a 3-month fellowship. It's not 3 months straight, but we're going to be spreading it out over 3 months to help you if you have a great research idea or if you have some data, help you put together not just the abstract, but a presentation to learn about different research methods, to maybe help advance your work, to give you some new information, some new skills, and for those who are interested to work towards actually writing up your results, perhaps for peer review. So unfortunately, we don't have an unlimited number of spots, but if this does sound interesting to you, please check out the website healthfellowship.co.ke. There's all the information you need there, including how to submit your expression of interest. And before you start yelling at me about the website, I noticed there was a small error and I just fixed it, but it won't be online till tomorrow morning. So don't rush there tonight, but just write it down and check it out. And of course, if you're interested and want to learn more about this program and how it works, just never hesitate to drop me an email and I'm happy to have a chat.
Thank you.
Thank you. Thank you. I can see. Okay.
So my Department of Health employees, healthcare providers, those who've joined in, they've been really asking me how to get your research idea published. So this is an opportunity for you, and we will work in together with you to make sure that whatever the study that you have shared with, we go together with the abstract, get it presented, and we would actually follow through with you to make sure that it gets published. So here's an opportunity for you. Do not miss it out. Thank you. Over to you, Phyllis.
Okay, thank you, Dr. Austin is asking if it's a requirement to conduct a research prior to writing an abstract, and what is the standard protocol or procedure?
Sorry,
Dr.
I got
Adam,
muted.
Denton?
Yes, sorry, I got muted. So yes, as I had mentioned, that for you to write an abstract is a summary of what particular study you have done or an intervention that you actually conducted. So if you have not done this particular intervention or this particular study, then there would not be an abstract that would be there. It would just be based on what are you planning to do. So that planning would not really explain what your results section would be there. Okay? Denton, would you want to add something on that?
No, that was great.
Okay.
Okay,
Phyllis?
thank you, Dr. Okay, I can see somebody has asked for the link and it has already been shared. And just to remind colleagues, the deadline for submission of abstracts is on 7th of June. And the second annual Mombasa Health Research Conference will be on 31st July to 2nd August. So we can mark the dates. I cannot see any more questions on the chat box, neither any hand up. Maybe we can give members some few minutes. Dr. You can give some wrap-up remarks. And then Denton.
We are very much excited with all these questions and all this conference that's coming up. So I look forward to engaging with most of you and make sure you do submit an abstract. Thank you. Over to you, Denton.
Yeah, just echoing, it's so great to see so many people online. I think research is amazing. So if you're interested, please, get involved.